Hi, my name is Dr. Tonya Nicole Taylor, and I am a faculty in the Department of Medicine in the Division of Infectious Disease and co-director of the Community Outreach for the Bridge program. Today is my pleasure to present a lecture on ageism and ageism in healthcare. So first, we would like to acknowledge our generous funding from Health Resources and Services Administration, HRSA, and from the Department of Health and Human Services, HHS. And I want to just remind you that the content of today's presentation are mine and do not necessarily reflect or represent the official views of HRSA, HHS, or the government. I have no conflicts of interest. So, our learning objectives today. By the end of this self-learning module, I'm hoping that our trainees will be able to do the following. To be able to define ageism and discuss the different types of ageism and its relationship to society and culture. Number two, discuss the impact of ageism on care and treatment with particular focus on ageist language within clinical encounters. Discuss common ageist assumptions among healthcare providers, and to discuss a model for which we can, a model that we can use to address ageism in clinical practice. So before I start, I really want you to think about trying to finish one of these sentences. Please pick one of these sentences and just quietly think about answering this question for yourself. The topic of ageism in healthcare is important because what I already know about ageism in healthcare is, as a future provider, I need to know more about ageism in healthcare because. So I'm hoping that we can build off of information and knowledge that you already have to be able to move forward in this learning module to enhance your understanding of how dangerous and insidious ageism is. So first, let's get to definitions. What is ageism? Ageism is a type of bias. As was defined by William Butler, who was one of the founders at the National Institute of Aging in 1969, he defined it as the systematic stereotyping and discrimination against people simply because they are old. I also want to show you the World Health Organization's definition of ageism. Ageism, as they define, is a combination of stereotypes, prejudice, and discrimination directed at people based on their age. Look, ageism is a problem. It permeates the attitudes of medical providers, the mindset of our older adults, and also the structure of our healthcare system. So, what is ageism? I want you to think of ageism as reflecting on these three particular acts in terms of stereotypes, prejudice, and discrimination. So ageism refers to how we think about older adults, how we feel about older adults, and particular actions that we may wittingly or unwittingly engage in that are discriminatory. And I want to first, as a medical anthropologist, I want to remind everyone, our trainees, that ageism is a social construct. What does that mean? It means that there's no biological, that while aging is a biological process, what it means to be young or older is socially constructed. This means that there's no inherent cultural meaning to this biological process. It means that cultures and societies imbue a particular meaning and value to youth and to older age. Aging around the world is perceived differently, and in some particular parts of the world, it is valued and highly respected. Ageism and culture, I just want to remind our trainees that ageism within our Western construct is very particular to how we in our society here in the United States think about older adults. Typically, we devalue older adults. We don't see them. They're invisible. They're not contributing to society. However, in other societies, older adults are highly valued members of their community. In particular, I have some examples, information here about how older adults in Japan are revered. It is the absolute responsibility of children to take care of their older parents. Japanese cultural norms suggest that caring for one's parents by putting them in an assisted living home is tantamount to neglect. I want to also say that our understanding and the value around this social construct of what is old and what is aging or ageism is also dependent on life expectancy. So it's contextual. So, for example, in the United States, if our average life expectancy is over 78, we might then start to think of individuals in their mid 60s and older as being older adults or older. However, in Chad, in North Africa, if the life expectancy is much considerably lower, 49, people who are in their 30s might be considered older adults. So these variations around what is old and who is old are culturally constructed as well as socially constructed. And it's very important for us to recognize that there's no one definitive or universal age for being considered old. There are different types of ageism. There's ageism that operates on the interpersonal level, that it happens in terms of interactions between individuals based on these biases towards older adults. Ageism also operates on the institutional level, where institutions perpetuate ageism through actions and policies, in particular maybe hiring practices. Then there's also the level of awareness. Are we aware of our ageism? There is intentional ageism, where people really understand what they are saying in terms of discrimination and stereotyping towards older adults. And then there is this level in which people are unaware of the fact that they are carrying ageist beliefs and practices. So, ageism absolutely can be explicit. Here is an example from a paper from Aronson in 2015, where a surgeon asked a medical student, "What specialty were you thinking of pursuing?" And when she answered geriatrics, the surgeon immediately began mimicking an older adult complaining about constipation and a high-pitched whine, making fun of the older adult. The attending surgeon had a reputation for being an outstanding teacher, yet repeats this parody throughout his surgical procedures. So he is aware that he is making fun of the older adult, and his ageism was implicit. Ageism can also be explicit. Healthcare trainees are sometimes exposed to persistent misconceptions that older patients are demented, frail, and somehow unsalvageable. It's always a bigger save when you help a 35-year-old woman with kids than to bring back an altered 89-year-old with a urinary tract infection, back to her semi-altered state. Ageism can also be internalized. And what I'm saying here is that individuals within our society can believe or buy into these ageist notions and beliefs that I am too old to do certain things, or that I'm limited in my abilities to participate in society because I'm old. I can't go ice skating or roller skating because I'm too old. And unfortunately, with internalized ageism, it can become a self-fulfilling prophecy. If we think negatively about the aging process and about being older, it can affect how we decide to act or interact, especially in terms of seeking care. So if you believe that your pain or your fatigue or your depression is a normal part of aging, you're going to be less likely to seek help.